Good afternoon, everybody. My name's Sam and I'll be your compere today. Thanks for joining us. I'd like to extend a special welcome to everybody joining us from our UK partner network today. I'm going to be shortly passing you over to your presenters. However, there's a couple of points that I'd just like to note before we get started. First up, we'll have some dedicated time at the end of the webinar for questions, but please feel free to type those into the chat box as we go ahead. And if there's anything of particular note, we'll ask those to Eric as we go on. Secondly, we also have a couple of handouts available for this webinar. In order to download them, within your control pane, there should be a handout section. So there's a case study and also a solution overview of the 7-signal solution. Okay. So your presenters today are David Smale, who's the Healthcare Account Manager here at Open Reality. He's going to be giving a quick overview of what Open Reality is all about, how we started working with the 7-signal, and also why Wi-Fi is such an important topic within the NHS at the moment. Welcome, Dave.
Thanks. Hi, everyone.
And our second presenter today is Eric Kamuli, who's the Customer Success Officer for 7-signal. Eric's going to be having a bit of a look at the traditional approach to Wi-Fi monitoring, where it feels short in the modern day, and how wireless teams can improve their approach. Thanks for coming, Eric.
Thank you, appreciate it.
Okay, so without further ado, I'd like to pass things over to Dave.
Thanks, Sam. I'm just going to take a couple of minutes just to explain who Open Reality are and give you guys some context as to why and how we partner with 7-signal. Open Reality started back in 1999, concentrating on application testing and performance. Whilst it's still core to what we do today, through our sister company Bright Cloud, we also work with data protection, security, and cloud solutions. More recently, Open Reality has made a very big push into the wireless space as a value-added distributor. We rely with vendors to cover every stage of the Wi-Fi lifecycle, from the initial survey through to design, implementation, and then ongoing maintenance and troubleshooting. We found 7-signal whilst looking for a best-of-breed wireless monitoring solution and really like the platform. Let's just say the rest is history. So why are we focusing on the NHS today? One particular organisation that we really feel could benefit from wireless monitoring is the NHS. As I'm sure you're aware, there's a big push at the moment for all NHS trusts to deliver Wi-Fi to patients and to visitors by the end of 2018. And with the paperless NHS initiative as well from the government, it's adding even greater importance on the wireless infrastructure that's already in place. With that, I'll pass on to Eric, who will provide a quick intro to 7-signal, explain why Wi-Fi healthcare is so complicated and what is the best approach for monitoring it.
Over to you, Eric.
Okay, thank you very much. I really appreciate the opportunity to present to you all today. And again, my name is Eric Kamuli, the Customer Success Officer for 7-signal. I'd like to start out just by giving a little bit of background regarding our company. So we were founded in Helsinki, Finland back in '07 by Nokia Networks engineers. Those engineers were working on 2G and 3G cellular networks, and they had worked on devising a system that would actually help improve the performance of those networks from the end user's point of view. As you guys are aware, in those early days, we all suffered from dropped calls, we suffered from jitter on the line, and we needed a system that would give the carriers the feedback that they needed proactively and continuously so that they could actually then improve the customer experience. Well, they had a vision, if you will, and they saw that Wi-Fi was coming down the pike and that it was going to explode and be incredibly popular. They said, why can't we take these principles that we've learned and apply them to corporate, apply them to business, apply them to different organizations in order to increase the customer experience or the user experience from the Wi-Fi point of view. And so they moved to Ohio back in 2013. Now the reason for Ohio, as you can see on the map, where we are in Cleveland, Ohio, is about halfway between New York City and Chicago. And the reason why Ohio was chosen was because Northeast Ohio was the headquarters for Aeronet. Aeronet was the company that developed the first commercial grade or commercial access points, and that was the company that was acquired by Cisco approximately 10 or so years ago. And the name Aeronet still remains today with the Cisco Aeronet line of access points. So we were very lucky to draw from a lot of talent in Northeast Ohio in order to build our company. And as a result, Wi-Fi is finally taking off and becoming mission critical, especially in healthcare. And you can see that we are well over 100 customers in 10 countries, and we have over 25 very large hospital systems that we're doing business with. I'm excited to tell you about how we're helping them today. So let's just talk for a moment about the mission critical use cases that are in hospitals. There are so many, and it is just growing exponentially. I think that the number of use cases in hospitals for Wi-Fi, I think, are more than in any other vertical market. Not only are we talking about devices that are in an operating room or in a patient's room, IV pumps, wireless EKG machines, basically anything that you can hook up to a patient, there's going to be some kind of telemetry that is depending upon Wi-Fi in order to report the vital statistics. But not only that, we have nurses who are using their workstations on wheels, or what we call WOWs. And those WOWs are rolling up and down the hallways, and nurses depend upon them to distribute and dispense medicines, also keep track of the electronic charts for their patients. And then you have doctors and all sorts of clinicians who are using tablets, who are using other types of mobile devices as well in order to serve patients properly. Keep track, again, going paperless is so important from a time and cost standpoint. And then let's not forget about the guests. So as you can see in the graphic that we have up right now, waiting rooms are places where not only are we waiting for service, but it's where our family members and our friends are waiting for results. And it's very important that even people in those waiting areas have good Wi-Fi experiences as well, so that they can communicate with the outside world with regards to what's happening with their loved ones. Very important as well. So glad to be able to talk to you today about our system. You know, it's really interesting because we actually found this interesting study from Ericsson, and it indicated that, in fact, poor Wi-Fi could be bad for your health. The neuroscience study measuring user reactions to Wi-Fi network performance, when I think it's no secret that when we can't upload or download that file, when we can't send that email because of a poor experience, it does cause us to get a little bit anxious, just adding insult to injury. So now what I'd like to do is just talk about the traditional approach to trying to solve these issues. So what we want to do is basically talk about this from the standpoint of your network infrastructure. So this is the traditional approach. Sometimes what we'll do is we'll take an access point when some kind of Wi-Fi issues are recorded in an area or reported, and we'll turn it into a Wi-Fi sensor. Now, there's a couple drawbacks to this approach. First of all, when we take the access point and turn it into a sensor, it's a very reactive approach. And not only that, but we're now taking the access point that was designed to serve clients and now turning it into a sensor. Thereby, it can no longer serve clients, and we're creating a coverage hole. And not only that, but when we create this coverage hole, then we run the risk of people that are in adjacent locations having a poor Wi-Fi experience as well. And the reason why is because they can no longer roam to that radio. So in effect, what we're doing is we're actually killing the Wi-Fi network in an area while we're trying to test it. Oh, and by the way, the problem that was experienced a few hours ago or a few days ago may be gone. So again, the ability to try to catch problems in the post problem can be very frustrating, can be very difficult. And when people report the issue with regards to the poor Wi-Fi experience, we're really left with little to no trace of how we can help them. So let's continue with the traditional approach. One of the things that we'll also do is we'll take a look at our Cisco Prime or our Aruba Airwave or whatever interface that we have that's managing our Wi-Fi infrastructure. Now, oftentimes we'll see a very good infrastructure point of view. It'll tell us about the different wireless LAN controllers, all of the access points and groups that are all connected and joined to the network. We're also getting very good bandwidth utilization statistics, and we're able to easily identify who our top talkers are on the network. But there's a missing piece, and the missing piece is in the space between the access point and the clients. And this can be very frustrating because oftentimes when we talk to people and we say, hey, how often does it take place where somebody will report a Wi-Fi issue, and then you look at the tools that you have today, like for instance, Cisco Prime, only to see that there's nothing wrong. And what I've been told by the myriad of professionals that I've spoken to is that this scenario happens far too often. That many times people are reporting an issue and the IT professional who's been charged with helping them has no visibility into what their actual experience is. They can't see what's happening on the client device. They don't know what's happening in the air, in the space between the access point and the client. Therefore, they don't have the information that they need in order to help this person, either in the moment or even proactively help this person from the standpoint of giving them the information that they need in order to resolve it on an ongoing basis. So this brings us to what Seven Signal calls as an outside-in approach. Especially in healthcare, there is going to be an explosion of devices that takes place in healthcare. IoT and the future of IoT and the healthcare, I would say that healthcare, from the statistics that we've seen, is probably poised for the most growth when it comes to IoT. And as a result, we need a different approach. We need an approach where we're actually out on the edge of the network, where the clients are experiencing the network. We need to see what's happening in the air. And in doing so, we now have the information that we need in order to not only help our customers in the moment, but also proactively take a look through a system of alerts and alarms, take a look at what's happening in the moment so that we can address it before there is some kind of mission critical failure that could, in many cases, affect patient outcomes, which could be very frightening. So what we're introducing is what Seven Signal would call Wi-Fi telemetry. And how do we accomplish that? Well, the first product that we have is called Mobile Eye. And Mobile Eye is an app or an agent that's going to help reveal the true experience of what's happening on a device, because it's software that will run as a service on your workstation on wheels. So in many hospital customers that we have today, they will take Mobile Eye and they will deploy it to their hundreds or even thousands of workstations on wheels, which are the devices that nurses will use in order to keep track of the electronic chart, or that they may use to dispense medicine. These carts will be rolling up and down the halls, and they experience sometimes issues. And again, a nurse who has to pause their work, a nurse who has to call for support, is a nurse that isn't serving patients. And again, we're trying to do all of the things that we need in order to smooth all of those friction points so that nurses and clinicians and doctors can do their job and put patients first. So when we have our software on the actual device, now we can see what a nurse or a clinician even means when they say that they're having a poor Wi-Fi experience. We can easily identify, is it their device? Did it fail to roam properly? Well, what access point are they on? What network are they on? What channel are they on? What's their signal strength? All of these clues are going to point to what the problem actually is. We're going to be able to identify, is this an access point that's having the problem? Is everybody having the problem in the area, or is it just one device? What are the adapters and drivers of that device? And are those adapters and drivers in that workstation, are they prone to having issues? and we can run reports and see which adapter and driver combinations are actually the ones that are most problematic on my network, then we can take proactive steps in order to alleviate this concern moving forward. Now, it is compatible with Windows and Mac, Android and iOS, and most of the workstations that are in hospitals will be running some kind of a thin client with a Windows operating system. It's easily deployed to thousands of devices in just minutes using SCCM or Microsoft Group Policy. And what you do is you program the different endpoints that you want these workstations to test against. You want them to test against or ping certain targets, perform throughput tests against endpoints that you strategically place in your environment. And you do this continually all throughout the course of the day as different nurses run their different shifts, and they are trying to use the equipment that they need in order to serve their patients. So Mobileye is very powerful in the hospital from the standpoint of and a very good use case in the hospital from the standpoint of the workstation on wheels. It's not the best fit for corporate right now, and the reason why is because we're smoothing out some of the issues that we need to overcome with regards to privacy and GDPR. Those issues should be alleviated in the new year, early 2019. But with workstations on wheels, it's really not a personal device. It's used by different nurses throughout different shifts on a 24-hour shift. And so therefore, because there isn't this personal identifiable information on the workstation, if you will, it's just a marvelous use case in the hospital in order to make sure that those workstations are doing their job properly. So there are some situations where you want extra protection, more coverage, and this is our second product, the Sapphire Eye. The Sapphire Eye is a device that we've created that you'll strategically place throughout the hospital. Radiology, the emergency department, the operating department, whatever it might be, where you really need to see what's happening in the air 24 hours a day, 7 days a week. Now, the Sapphire Eye is a client. Now, as a client, what that means is that it needs to go through all of the phases just like a normal client would in order to get onto your network. So first of all, it needs to be able to associate to an access point. And if for whatever reason it can't associate to an access point, you'll be instantly notified with an alert saying that this access point is having trouble or difficulty. Second, a Sapphire Eye has to authenticate to your network. We give it credentials, just like a client. We can give it credentials to get onto various networks. We can program the Sapphire Eye to get onto a guest network where we even need to go through a captive portal. And so in that manner, if there is a problem with authentication and getting onto the network, you'll be instantly notified. Third, the Sapphire Eye needs to get an IP address. And in that manner, we're actually testing DHCP services. So what you can do is you can actually ensure that all of these different phases and stages are happening properly before you even get onto the network. And if for whatever reason you can't authenticate, you can't associate, you can't get an IP address, again, you'll be instantly notified. Most of our customers don't have good visibility into DHCP or Radius. And so this provides a level of visibility that is just unprecedented. And then finally, once the Sapphire Eye is on the network, now it's going to perform like a client doing client-like things. We're going to be measuring 24 hours a day, throughput, packet loss, latency, and jitter. And in that manner, actually identifying what's the experience, what would it be like to experience the Wi-Fi network in a particular area. And using the alerts and alarms, if there is a drop in throughput, if there's a spike in jitter, you'll know about it instantly so that you can spring into action and take care of it before anybody hopefully notices or complains. So very powerful from that standpoint, putting the Sapphire Eye in these key areas of the hospital. There's a few other goodies that are built into the Sapphire Eye as well. So for instance, there is a spectrum analyzer built into it. And 24 hours a day, we're able to record what's happening in the air, and we can store 90 days of that data for you. So this is really powerful because oftentimes people report Wi-Fi issues that happened yesterday or last week, and now you can go back in time like a time machine, and you can actually see what was happening in the air at that time. Were there drops in throughput that we didn't, that are associated with some kind of interference or in the spectrum? You'd be able to see it. And perhaps one of the most powerful features, especially for hospital networks, where there are many clinics and hospitals all over the state or all over the country, is the feature of remote packet capture. So imagine just being able to turn on remote packet capture for a few seconds, and then in a remote location, you now alleviate the concern of having to drive to that location, take out a tool, and walk around trying to catch a problem which is likely gone. So having a system in place is extremely important for improving patient care, for improving the work that nurses, doctors, and clinicians are doing. So let's just review the product lineup here for a moment. On the left, Mobile Eye, which is great for workstations on wheels in the hospital, very powerful in order to track and characterize the roaming behavior of those devices. On the right, we have Sapphire Eye, which is a high-performance client that runs 24 hours a day, 7 days a week. It is a power over Ethernet client, so what that means is that we're actually able to run the tests in both directions. We can see what's happening over the air, and we can see what's happening over the wire. And this is extremely important in trying to figure out where the true problem is. Many of our customers spend an awful lot of time trying to figure out, is this a wired network problem, a Wi-Fi problem, or a client device problem? And with this suite of products right here, we've got all of our bases covered. With 7 Signal, we can pretty quickly and easily see, okay, I've got a wired issue, a network issue, I've got a Wi-Fi issue, something in the air, or it's perhaps a device driver combination that's happening on these workstations over here that haven't updated yet. And in that manner, we reduce finger pointing between departments who are trying to ensure that the infrastructure is where it needs to be in order to serve doctors and nurses so that they can serve patients. All of this data is going to go up to the cloud, where you just log into a web page and you can now view dashboards, the performance analytics. You get all of the good information and detail that you need. So let's just review a quick success story. This is a hospital that is right down the road from our headquarters here, Akron Children's Hospital. You can see on the left some of the characteristics of that hospital. 360 beds, almost or over 4,000 staff members. Just like what everybody experiences, they have the same problems. They have problems with workstations on wheels. They have problems where with their electronic health records rollout, they were very concerned about whether or not their network is going to be able to take it. Similar with the NHS, with trying to go paperless. It's going to be very, very touchy with regards to whether or not all of the facilities can actually handle the new load. And then even if we have a great design in place, and we might use a system or a tool like Ekahau in order to create that good design, we now need a system in place after the fact in order to monitor the performance, because as we know, the network is changing all the time. There's equipment, there's moving in and out, there are beds moving in and out of, or down the halls, in the elevators, down, up and down, or in and out of rooms. And so the environment and the air is always changing. And so even with great design, you need to complement that design with a system of performance management for your Wi-Fi network. So in this case, as you can see, we put in many Sapphire Eyes. I'd say we put in, I think we put in about 35 to 40 Sapphire Eyes around the hospital. And we were able to identify issues with those workstations where they had poorly performing device drivers. it was a problem that they had chased down for weeks. They couldn't figure out what was going on with certain workstations and why some were performing well and some poorly. Well, we were able to get to the bottom of it, and we were able to have a huge increase in their throughput, which again affects patient outcomes, affects the work that that nurses and clinicians can do. We were able to deter a major rollout, a major threat to the Epic rollout. Epic is the name of the electronic health record system that they used. They were able to really identify the soft spots and the areas of interference in their network so that they could take action accordingly. It was very exciting. Well, what we're going to do now is we're going to transition to a product demo. I'm actually going to share with you my screen, and I'm going to give you some insight into the software and how it works. So let's take a look at that right now. Okay, Carlos or David, I hope that you're able to see my screen. Okay, just give me a yes.
Indeed, yeah.
Okay, absolutely great, thank you. So what we're looking at here is actually a hospital customer. And we're looking at their Mobileye screen right now and how they're using Mobileye. So they have a variety of clinics and outpatient facilities, as well as main hospital here in Ohio, in Cincinnati, Ohio, is what we're seeing right here. And you can see located on the map are these different facilities. As you can see over here on the right, these are some of the key performance indicators that we're using in order to measure performance. What I can do is actually go over here to reports and take a close look at how the system is doing and how their Wi-Fi is. The first report that I'm going to run is what we call the client platform report. Think of the client platform report as like an inventory of the different kinds of devices that I have on my network. The make, the model, the adapter and driver, and their performance. As you can see here at this hospital, they use Lenovo Workstation on Wheels. Okay, and they have 339 of them, as you can see. But look closely, they have different models of workstations, and those models have different Intel wireless adapters. Not only that, but they have different versions of those adapters as well. So we're actually very easily able to see. So for instance here, out of 10 workstations with this configuration, 2 of them have this version of the driver, 2 of them have this version of the driver, and 6 of them have this version of the driver. And sometimes what we see are vast differences in performance with regards to upload and download throughput. Based upon the driver version, and it gives an indication of where we need to act proactively in terms of upgrading the workstations or downgrading if in fact the upgrade went poorly, so that we can in fact get these workstations working properly. Look at this one here, all of the different versions of drivers. Very important to keep track of these things, because as we know, it's the driver and the adapter combination that dictates most of the time roaming. And so if there is a problem with sticking and roaming, then one of the places we want to look are these adapters. Now, with that said, we can actually run another report in order to identify, do I have clients that are having trouble roaming? And I can simply click this report right here and identify which workstations maybe don't roam so well. And right here you can see, this is the one on top. I can see the radios that it's been attached to, the access points that it's been connected to, the channel and band that it's been on. Let's take a look at this one right here. All I need to do is click into it, and when I do, it's going to take me to a client performance page for that workstation on wheels. And in that manner, I now have all of the information I need in order to see what's happening. Over here to the right, you can see I have a roaming history, where I can actually see every access point that I roam to. Down here, I'm actually able to track signal strength and also the signal strength of all of the best neighboring access points. Down here in the lower left, I'm able to track every single channel and every single access point that I've been on for the past 24 hours. and identify maybe areas where I was on 2.4 band when I shouldn't have been. Up here along the top, I'm able to see the instances where I was having trouble roaming or I was having trouble with Wi-Fi. I can just click on the red spot right here and watch what happens on the right. You'll see it change over to the Wi-Fi tab, and it should light up very quickly where the problem was. And there you can see September 5th at 4:20 in the afternoon. The signal strength was -74, which is right on the edge of where it should be. Okay, right here you can see there were some signal strength problems, and I may use that in order to take a closer look at my design and identify where there might be soft spots in my coverage. So being able to get the full picture when somebody calls, being able to look at their workstation and identify where its problems were and why they were taking place is very critical and very, very useful. There's also some built-in troubleshooting. So if I mouse over roaming right here, then what it'll do is it'll bring in a troubleshooting pane from the side. And I can follow some nice and simple steps in order to resolve. So this is Mobile Eye. And again, the use case for hospitals is workstations on wheels, where I can get everything I need to know about the performance of that workstation as it rolls up and down the halls as doctors and nurses and clinicians are trying to serve patients. Now, there is also another aspect of our software, which is the Sapphire Eye, of course. Let's take a look at that. So here is the page for Sapphire Eyes. And as you can see over here on the left, this is our office, and we have it broken up by floors, first floor and second floor. And the Sapphire Eyes continually, 24 hours a day, they're trying to connect to the network. They're trying to authenticate, get an IP address, and they're then trying to measure the quality of the experience. So connectivity is really interesting because you can see here that in the middle of the night, there are some drops on 2.4 where we're not able to get connected. Those will generate alerts, and those alerts will come in the form of emails or SNMP traps. So you'll know instantly if there's an area of the hospital where, for whatever reason, we can't get connected. It could be due to interference, it could be due to congestion. Same thing with authentication, and same thing with IP and DNS services. Let me just click into one of these for a moment here so that you can actually see some of the detail that we're able to give you. When I click into IP and DNS services, look at this. I'm able to actually track and trace all of the phases of DHCP and getting an IP address. The retrieval time, server responsiveness, the requests offered and made. So in that manner, I can identify exactly where the problem is, on what band, either 2.4 or 5, and in what area, because I know where the eye is located. It could be due to congestion that there's a problem. I would be able to see that as well. Now, once I'm on the network, there are a variety of quality key performance indicators that we use in order to see how an area is serving clients. Now remember, the Sapphire Eye is a client, and that client is actually doing the things that a client does, like upload and download files, try to reach servers, simulate voice over IP traffic by simulating voice calls. And now you can see here what some of the statistics are. So here, as you can see, we've got a variety of throughput metrics here. And you can see that we're measuring both 2.4 and 5 gigahertz. You can put in a variety of ping targets, almost like a heartbeat. We're making sure that our resources have the ability to reach certain servers all throughout the day and night. And again, if they can't reach those targets for whatever reason, you're instantly notified. You're not finding out about it hours later when everybody is upset and patients have actually have had to have some kind of delay in service because we're chasing down Wi-Fi issues. No, we don't have to do that anymore. Same thing with web page download. Now this is these KPIs, these metrics here are particularly important in hospitals where nurses and doctors will be using call badges by companies, Zebra or Volt or whatever system there is, where they're depending upon communication on these devices in order to serve patients best. Unfortunately, most organizations don't have a way to really track the voice over Wi-Fi performance until now. What our Sapphire Eye is doing is measuring packet loss and jitter 24 hours a day, and we're actually calculating our own MOS score so that we can actually grade the talking and listening performance all throughout the day and night, and alert you if there is some difficulty in a part of the hospital network where voice over IP or voice over Wi-Fi is not functioning up to your target specification. Now down here, there's a couple other metrics that I really love. For instance, the signal to noise ratio. Being able to track the signal to noise ratio and saving that for 90 days is really powerful. And the reason why is because it's almost a way to catch interference. It's really important, especially in a hospital where there's just so much dynamic activity. There could be issues and where the noise floor raises up for a certain period of time for some reason, which could vastly impact performance. But the issue comes and goes, and it's very difficult to track. Well, now with 7Signal, all you can do is just look at this here, and you can see per area, everywhere we have an eye, we can actually track the signal to noise ratio and make sure that there are no changes in the noise floor that are actually affecting performance. And then down here, we have some really nice key performance indicators that we use in order to identify whether or not we have congestion in an area. So we're looking at airtime utilization, which is particularly important on 2.4, channel utilization, number of clients per access point, station count. All of these things are helping us determine if we really have issues in the air with congestion or interference. So, one of the things that I also wanted to show you really quick is that if we do have that spectrum analyzer, and I actually just brought that up. I wanted to show you what that looks like here. This is in our office. We're looking at the spectrum. This is over a week of time, and we can see that every day we're having problems on 2.4 on channel 6. Because the Sapphire Eye has a directional antenna array, we're actually able to see the direction where the interference was coming from. And as a result, we were able to go to that area and look, and lo and behold, we saw a security camera. And what we're able to do is then make some adjustments accordingly. If the security cameras are going to come on at night at a certain time, and they are going to cause this much interference in an area, then we know what channels to avoid because those are being used. They're being blasted, if you will, by that device. So that's just a flavor of our system. Hopefully you were able to get a really nice taste for what a system like this can do in a hospital, how it really provides you the coverage and the visibility that you need in order to really quickly and easily determine, do I have a wired, wireless, or do I have a client device issue? And we talked about some of those use cases. So with that, I wanted to hand it back over to Dave, and I'm going to do that right now and allow you to maybe talk a little bit about the commercials and such like that.
Yeah, great. Thanks, Eric. So yeah, thanks for that in-depth demo. We'll go to the questions shortly. Just wanted to touch on the procurement routes really. As you mentioned earlier, Open Reality is a UK distributor for 7Signal. We've got a wide-reaching UK partner network, and I know some of our partners are on the session today. Just wanted to also make you aware that 7Signal can be purchased by a number of different frameworks. So two that we've highlighted here, one, the Network Services Framework, and also G-Cloud 10. But there's a number of routes to market. It would be via a partner network that we've got set up. But if there's an interest in taking the product further, then obviously we can put you in contact with one of those. In regards to kind of next steps, really, I know Eric's gone into a lot of detail on the product. There's more reading material on the website at 7signal.com. Alternatively, if you'd like to go a step further, we can either book one-on-one product demos or one-on-one on-site meetings where we can come and discuss your wireless network itself and obviously how 7Signal will fit in. There's also an option to do a proof of concept as well. So there's a number of different routes to market, and there's also a number of next steps as well.
Perfect. Right. So we're going to move on to questions. So if you've not already typed your question in, then please do so now, and Eric and Dave will do their best to answer it. So the first question I've got, Eric, is how many access points can a Sapphire Eye sort of cover? Is it done on a radius? How does that work?
Yeah, very good. So one Sapphire Eye, because of its unique antenna array, it's a 6-sector antenna array with high gain, 4 dB of gain. What that means is that we can actually point a beam of energy in one direction really far, sometimes over 100 feet, depending upon the topology or the topography. As a result, one Sapphire Eye has the ability to connect to 4 to 6 access points at neg 65 dBm or better. Now, it's really important that we connect and we hear those access points at neg 65, because that's just like a client would. So 4 to 6, and depending upon the environment, it can even be more. If it's a big room with not a lot of concrete and metal, then sometimes that can even be 7, 8, or 9 access points for just one Sapphire Eye. So you're getting a really nice coverage ratio with just one of those units.
Perfect. Second question is, what are the primary Wi-Fi security and privacy requirements in healthcare, and how does 7Signal ensure regulatory compliance?
Sure. So just like here in the United States, we have what are called HIPAA compliance requirements. And what's most important about that is the idea of personal identifiable information, medical information that's tied to a patient. Rest assured that there is no patient information or personal information that 7Signal is keeping in any way, shape, or form. So for instance, the type of information that we're collecting, that we're gathering, and that we're storing is purely Wi-Fi related information. What network are you on? What access point are you connected to? What is your signal strength, and what is your performance? Your ability to upload and download files, ping or reach certain servers. And so in that manner, all of that data is going into our database, and it's really not personally identifiable or tied to a patient or tied to an employee. So we haven't had any issues with the hospitals that we've served here in the States.
Great, thank you, Eric. I think the final question is just talking about in terms of deploying the sensors. What are the requirements? What is it that they need in order to be able to deploy them?
Mm-hmm. So the most important thing is they do require power over Ethernet. And so with power over an Ethernet, you're going to obviously run a wire to the area. What you do is you would give us a map of an area. So for instance, a floor plan, and most of you will probably have floor plans already today. And on those floor plans, you'll have marked where your access points are. If you simply submit those floor plans to us, just maybe tell us a little bit about the environment, then we should be able to then place strategically where Sapphire Eye should go and where you would need to install them. Then what we need to do is, again, we need to give them credentials. We're compatible with 15 different forms of authentication, EAP, EAP with PEEP, MS Chat v2, whatever it might be. If we need to go through a captive portal, we then program the Sapphire Eyes to get on whatever networks we want them to get on with whatever credentials are required. And then they start scanning. We assign what access points we want them to continually measure. So for instance, let's just say that we install a Sapphire Eye and we do our scan and we identify that there are these 5 or 6 access points that we want to continually connect to and test 24 hours a day. We assign them. And then that's pretty much it. Then the idea is that we're trying to make it as plug and play as possible. And obviously you call us for any, you call Open Reality for any issues that you may have. Open Reality has an open relationship and channel of communication to us, and we'll give you everything that you need in order to be successful.
Okay, one final question is, you mentioned the Ekahau design tool. Is there any integration at all between that and the 7-signal system?
Yeah, actually there is a bit of integration. So for instance, and I'm not 100% familiar with the Ekahau tool, but when you're using the Ekahau site survey, what we've done is we've actually put in our antenna patterns and specifications for Sapphire Eyes. And what you can do is you can actually then in the drop down where you can actually use the Ekahau site survey in order to determine precisely where you should put Sapphire Eyes based upon the specifications that we put into the system. So there is a small integration there that our customers have been able to take advantage of.
Okay, perfect. That concludes the questions. Obviously, if you do have any other questions later on, then please get in contact with either David or a member of the 7-signal team. We'll be circulating a copy of the recording along with the 2 handouts within due course, hopefully tomorrow. So keep an eye out for those. So thanks again, David. Thanks, Eric, and thank you all for joining us.
Thank you very much.
Okay, goodbye, everybody.